your period, and that's the time when your estrogen goes up. So that 9-month period gives you a rest from exposure to your estrogen hormones. So that's the explanation why the risk decreases if you have children. So I just want to clarify, when we say risk factor, it doesn't mean that if you have this risk factor, you'll get it 100%, that it's inevitable. No, it's just mean that compared to the person who doesn't have this risk factor, your chances of getting that cancer or malignancy is higher. So there's these risk factors that you can modify. You can try to decrease it or change it or avoid it, so to prevent the cancer.
I'll give chance to others.
Thank you, Shishi.
Hi, my name is Gail. I'm also a blogger. So I have a question. This is a general question for breast cancer, because breast cancer is the most common for women, right? And what does Manilamed offer for treatments for early detection? Like, for example, there are already some hospitals who are offering PET-CT scan or intraoperative radiation therapy to lessen the treatment from 5 weeks to about 40 minutes, something like that. Does Manilamed also offer that?
You mentioned some sophisticated equipment that are used in the treatment of cancer. But if I got it correctly, you were asking about early detection and prevention.
Yeah, and also
Yeah, as far as early prevention, early detection rather is concerned, these equipment aren't used as standard of care. But as far as breast cancer is concerned, what is really recommended is mammography. Yeah, but for treatment, well, it depends on a case-to-case basis. For example, a PET scan or PET-CT scan is it's a machine that tries to detect the presence of malignant cells throughout the body. We don't routinely perform it or request it for a patient with early breast cancer. It usually is tailored for those in whom we suspect to have metastasis, and in whom the treatment may change if we see a positive result in the PET scan. If we were quite confident that this patient has localized breast cancer, meaning it's just in the breast, there's no spread in other areas, as noted in X-rays or ultrasounds, then there's very little benefit of performing a PET-CT scan. But if we feel that PET-CT scan may change our management, then we would request that. So it's really a case-to-case basis. As of now, the PET scan is not yet available here, but from what I hear from the admin, I think they're working on it. I'm not sure exactly when we're going to have that machine, but if I remember correctly, parang sabi baka this year. I'm not sure though, but it really depends on the negotiations. But people are working on it, so very soon, watch out for the PET-CT scan.
Yeah, but just to add as well, I got an information as well that the Manilamed Cancer Care Center also now provides radiation therapy using the recently acquired Electa Synergy Linear Acceleration, or the LINAC. This is the latest innovation in real time, which has image-guided technology known as X-ray volume imaging. Just to add information.
Yeah, in addition to that, since you already mentioned radiotherapy, the LINAC is the current machine that we have that provides external dim radiation to most patients who need it, meaning the machine will emit high energy beam and target the site where the cancer is. It's different from IORT, the intraoperative radiotherapy, because the IORT machine delivers radiation intraoperatively, so inside the OR. So there are specific indications for that. Not all cancers may benefit from that treatment, but At this moment, it's not yet available here. No? I'm not sure if the hospital has plans to acquire it, but it may be promising to use for specific cancers only, not for all.
Okay, thank you. And another question for Dr. Diwan. So, I was just curious if the prostate is already removed because the prostate, from what I know, it like secretes or protects the sperm, something like that. So, if it is already removed, can a man still produce sperms or can produce a child through reproductive?
Hindi na. May ano pa rin ejaculate, pero mostly as I told you, 25 to 30% kasi ng ejaculate comes from the prostate. So mostly yung prostate more of it gives nutrition to the sperm. So, pag tatanggal na yung prostate, no?
Pero it doesn't have any effect on the body. Like for example, the kidney, if you remove one kidney, your body can still function well. So if the
Okay lang,
prostate is
kahit
removed,
tinanggal yung prostate.
okay lang. But hindi na siya makakaanak.
Yes. Sperm makaka-produce pa. Pero yung nutrition from the sperm nawawala.
Wow. Okay, thank you.
Hi, my name is Mons. I'm also a blogger like them, a mommy blogger. My question is related to breast cancer. Is it necessary to remove a breast tumor which is benign?
It will depend on the findings of ultrasound, of the mammo, on the physical exam of your physician, because you will only know 100% that it's benign if you did the biopsy. So it's a combination of what your doctor sees in the diagnostic. If it's highly suspicious for a malignancy, then your physician can push to a biopsy. If it looks benign, seemingly benign on ultrasound and on physical exam, and it's small, there is an option to do a surveillance or observation only to see if the tumor, the mass is stable or if it increases in size in a few months' time. Okay?
Thank you.
Welcome.
Okay, I'm required to answer. Mom blogger, working mom blogger. So my question will come from my experience. I have two friends, my two bosses, who both survived from cancer. I'm not really sure what kind of cancer, but they used what you mentioned, immunotherapy. And so, as Dr. Caroline, you have mentioned that Manilamed tries to offer affordability, availability, and what's the other one? Accessibility. Okay, so it's just mind-boggling how the cost of dying of cancer is just smoking and those things that you mentioned. But for me, I think it's also about poverty. Because if we have that accessibility and affordability, if only immunotherapy was provided for everyone, then mortality rate will shoot up. So how is it possible that the poor can afford immunotherapy?
Not all cancers would warrant immunotherapy. In gynecologic cancer, I'll just focus on gynecologic cancer because that's my specialty. That's not the standard. First line. Standard as, for example, cervical cancer, I mentioned it, surgery, radiation, chemotherapy. Immunotherapy is a totally different treatment. And for cervical cancer, immunotherapy comes in as a second line palliative treatment for those that resist the standard treatment. Right now, it's really very expensive. It has just been introduced in the country. Dr. Sakdaran has more experience with it, but gynae-wise, so maybe what your friends have or your bosses have are not gynae malignancies because they're not the standard. What I'm saying, Manilamed is trying to make it affordable, accessible, available are the standard treatments: surgery, radiation, and chemotherapy.
Just to put things a little bit in perspective, immunotherapy is really right now recommended more for metastatic disease, meaning advanced cancers again. And so patients who undergo immunotherapy are really not expected to be cured. It's really meant to delay progression of treatment and maybe prolong the survival of patients. And this has been actually documented in several clinical trials that it does prolong the survival of patients. But it really doesn't cure these patients because they already have advanced disease. And so what Manilamed really tries to do is to make access to early screening, early detection and screening, so that it will be more possible to cure early cancers. Kasi that's sabi nga, an ounce of prevention is better than a pound of cure. And doing prevention and early detection really increases the chances of surviving from cancer.
All right, thank you. Thank you to our first row of doctors. All right, so now we have a question from...
Hi, I'm Loriza from Mami Vlogger. Sorry, pero ito, ano lang, parang tanong ng tanga. Okay? Kasi di ba all female and male may cancer. Pero ano ba talaga yung dapat na procedure? Parang, kunyari ako, gusto ko, natatakot ako kasi like, my grandma, my mom died of cancer. So, hindi, magkakaiba yung cancer na nila. So, paano ako magpapa-check up to find out if I'm safe or there's a probability na meron something? Kasi, like, medyo nakakasad lang kasi the other day, kausap ko yung daughter ko. She says na, parang, Ma, since namatay si Lola, si nanay ng cancer, pag ako nagkasakit, wag mo akong papagamot. Parang tipong cancer has no cure but it will only financially drain you. Parang ganun. So, parang, ano naman? So, ano lang po, paano ba dapat ko sila encourage? Ano yung para sabihin sa kanila na gaano kasimple magpa-check up just to know paano ma-detect kung meron whatsoever cancer there is na probable